Whenever you're ready, Joe, I think it's
Yeah,
12 o'clock. You can join when they're ready.
great. Thank you. Right, 12 o'clock it is then. I'm sure we'll have some more people joining us over the next couple of minutes. But yeah, afternoon, everyone, and a really warm welcome to today's Respiratory Matters webinar. Thank you for taking the time for joining us. And for those who haven't met me before, my name is Jo Oliver, and I'm the Respiratory and Diabetes Network Manager within Wales Performance and Improvement. It's really great to see you all, and thanks for joining us today. I think one of the great things that we value most about these sessions is the opportunity to share learning and create space for important discussion. And if you're new to the Respiratory Matters webinar series, our aim is to keep these sessions useful, really importantly, incorporate current research and support the work that you're already doing. So again, I hope you really enjoy this afternoon session. Just a bit of housekeeping before we begin. Just going to ask you if you can keep your microphones muted. And if there's a lot of us joining, we find that keeping your camera switched off during the session just helps as well. So thank you for doing those quick couple of housekeeping bits and pieces. We are recording this afternoon's webinar, and it will be available on our Respiratory Matters Teams channel. We'll also upload it onto our network's website after the session. And if you've got any questions during the session, just feel free to add those into the chat. And we've got a session and time allocated at the end, and we hope to be able to answer as many questions as possible then. So yeah, keep adding those questions, and we'll give you time to ask directly questions at the end. If there's any of the questions that we can't answer, we'll collate and share those answers afterwards as well. So today's session is titled Sex, Hormones and the Lung, Rethinking Asthma and COPD in Women. We know that women's respiratory health is an area that has historically received less attention, particularly when it comes to understanding how biological sex and hormonal changes influence respiratory disease. So today's sessions will explore how hormones shape women's lung health throughout the life course, including the impact of menopause on asthma and COPD. It'll also look at why women often experience worse asthma symptoms and faster lung decline from smoking compared with men. So we hope the session will help build understanding and prompt reflection on current practice, but importantly, support more personalised and equitable approaches to care. So today's speaker, we're really, really lucky. I'm really pleased to welcome Christine Musuko. And my one important thing was to learn how to say Christina's name properly. But we're really delighted that Christina's here to lead today's session. Christine is doing a PhD in immunology at King's College in London, which is funded by Asthma and Lung UK. And she's got a great supervisor, Professor Mona Bafatel. She's a background in biological sciences alongside specialist training in respiratory nursing, and also holds an honorary clinical contract with Guy's and St. Thomas's. Many of you may recognise Christina from the Primary Care Respiratory Society conference last year, where she gave a fantastic and very well received talk on women's respiratory health. And we really are fortunate to have her with us today in Wales and to share her work and her insights. And again, Christina's research focuses on the role of estrogen in women with respiratory disease, specifically asthma and COPD. And she says she's passionate about advancing equity in respiratory health and connecting research evidence with clinical practice. So Christina, thank you so much for joining us today, and I'll hand over to you. I'm really looking forward to hearing your presentation here today. Thank you.
Thank you very much for that wonderful welcome. And thank you so much for having me here today as well. And you did an excellent job with pronouncing my name, so thank you. So thank you everyone for joining. So today I'm going to be speaking, as mentioned, on sex hormones, focusing specifically on estrogen and the women's life cycle. And I'm hoping to convince you today that hormones play a part in both asthma and COPD. So I'm going to start firstly by grounding us in just the scale of the problem of both of these conditions. So we know that asthma and COPD are not niche conditions. They're two of the most common chronic respiratory conditions that we manage in the UK. So around 7.2 million people living with asthma and around 4 deaths every single day in the UK. And we also have staggering statistics for COPD, which is that we have at least 4.5 million people, 4.5% of people who are over 40 who are diagnosed with COPD. And actually, a lot of COPD is underdiagnosed. So huge burden on us as clinicians. So I want to start first by sort of talking about the gender disparities that we see before talking about the sex disparities. So as we know, gender and sex are intertwined. However, when we look at gender, women are in the social context disadvantaged when it comes to COPD and asthma. We know that women are more likely to have anxiety recorded as a comorbidity, and there is also evidence of implicit bias, actually, looking at differences related to clinicians and gender bias. We also know that, especially for COPD, typically that was ascribed to be a man's disease, and that was because mostly men were known to be smokers. But these things have changed. So I'm going to talk about the context of these diseases with reference to severity and symptoms, treatment and management, and pathogenesis and clinical course. So next we'll go on to the sex side of things. So women are also biologically disadvantaged. Unfortunately, this is an intrinsic factor that we cannot change, but the more we know about it, the better we're able to treat our patients and also to advise them. So we know that biologically, women are born with the XX chromosome, and they are genetic factors. But today, specifically, I'll be focusing on the evidence looking at sex hormones, and also, again, talking about severity, symptoms, treatment management, and pathogenesis. So the first question that I'd like us to think about is, what are the differences in severity and symptoms between men and women, and how are hormones involved through the life cycle? I want you to keep these questions in mind as I share with you some of the evidence relating to this. So firstly, when we look at mortality data, we see a consistent pattern, particularly for asthma across the years. And what you see on the x-axis is from 2001. You can see the red line there shows higher than the blue line, indicating that mortality is higher in women than in men. And this was a fantastic report by the Asthma and Lung UK, which I encourage you to look at and will be part of some of the links that I share at the end. And then what we see in COPD, you can see the blue line again represents men and the pink line represents women. And what we can see is that there is a trend going downwards for men in mortality. And we unfortunately don't see the same trend for women. So to me, this suggests that something clinically important is being missed for women. So again, here I'm presenting data that is summarized really from asthma and from COPD. And I'll start off with asthma, and this was a systematic review, look and meta-analysis, and this is a forest plot that you're looking at. And what we find in this review is that it's been reported that women report more ED visits, women report more asthma physician visits, so GP visits, and women were found to also report to be receiving more reliever prescriptions compared to men. And this was about a study that compared participants across lots of different cohort studies of about 200,000 patients. And when we look at COPD, the clinical presentation differs from men. And again, this study summarized lots of different studies globally. And what they found was that women had worse lung function, so they have a greater lung function decline compared to men. They also suffered more exacerbations, more breathlessness, and worse quality of life. And unfortunately, as you can see, these studies also incorporate looking at some of the gender factors that could be related to this, which intersect with the sex factors. So women are more likely to be diagnosed with anxiety and depression. And so then also some studies have shown that are then more likely to be dismissed when they come in complaining with symptoms of breathlessness. So the clinical picture differs. And why is that? Well, I'm going to start with asthma first. What we know about asthma is that often it's diagnosed from childhood. So luckily we have data from asthma looking at the influence of hormones all the way through the life course, whereas for COPD it's diagnosed later. And so the evidence starts to come in much, much later. So this first part is going to be more about asthma in the early parts. So something that's been noted globally is that before puberty, asthma is more common in boys. And after puberty, the pattern reverses. In adulthood, asthma is around twice more common in women. Between the ages of 20 and 50, women are approximately 3 times more likely to be hospitalized. And that's just not a subtle difference. It's a clinically meaningful shift in risk. And the other thing that's been found strikingly in studies as well, in cohort studies, is that testosterone appears to be protective. It's been correlated to have, it's been correlated with better lung function and reduced inflammation. So all of this, sorry, bear with me, all of this evidence put together shows us that there is a clear shift at puberty. And that's a key point at which estrogen surges in women and carries on being high throughout the life course. So at this point, I want you to just think about this question. What percentage of women do you think experience perimenstrual asthma? And just to explain a little bit about perimenstrual asthma, if you've never heard of it. So this is a phenomenon that's also been noticed in the literature, where women experience decline in lung function during the menstrual cycle, and particularly during the luteal phase. And as this graph shows, what you can see is that at the luteal phase, there is an increase in progesterone. Estrogen is high, but not quite as high. So that ratio, something is happening there that causes a lot of women to be presenting with what's now known as perimenstrual asthma. So what the studies show actually is that it's around 11 to 45% of women who experience perimenstrual asthma. At the low end, that's about 1 in 10 women, and at the higher end, that's nearly 1 in 2. So that's quite significant, really. in terms of the burden that women have. So going back to the first slide, when I talked about the burden of disease, what this is suggesting is that women are taking up more of that burden of disease. And this is a clear and consistent pattern that's been seen. And some of the mechanistic studies have shown that at this point, there is increased airway hyperresponsiveness. There is also increased inflammation, type 2 inflammation, in women that are experiencing lower lung function, and also presenting more to A&E. So the next sort of distinct life course event for women is pregnancy. And again, I want to pose a question to you to think about: what do you think is happening at this point? And have you heard of symptoms changing in women? With this one, the literature is quite consistent, and what we can see is that a third of women worsen, a third improve, and a third remain stable. And this has been seen across many different cohort studies. And something that we definitely know at this point in time as well is that poorly controlled asthma and not taking corticosteroids, inhaled corticosteroids, is a bad combination for women, which leads to adverse outcomes. And so at this point, it's really encouraged that women do take inhaled corticosteroids and that they're not undertreated. And so now looking at the next point in a woman's life course, which is the menopause, I've just picked out one of the key studies here, looking at about over 31,000 women. And what we see in this study is that women who experience menopause, not just menopause, they stratified women by whether they were experiencing early menopause or menopause at the usual age. And when I say early menopause, they classified that as below the age of 45. And what they found was that women have a 52% higher risk of developing asthma. So women who undergo surgical menopause were also found to have 33% higher risk. And then women who are also taking estrogen and were on HRT, so HRT, hormone replacement therapy, can have just estrogen or other hormones, were actually found to have 50% higher risk. So when we a high risk of the main outcome, which is the severe exacerbation. So interestingly, what this shows us is that it's not just the menopause, different stages of menopause matter, but also including that how the menopause is treated, whether they're taking hormone replacement therapy and how long they're taking it for. So at first glance, it looks contradictory, but I think this is something that is an area that needs more investigation to understand clearly. So when we look at COPD, what we see is that there is also a strong signal with menopause. And what we see here, again, I've just picked out 3 key studies. The first one shows that menopause is independently associated with chronic cough and phlegm. So women experiencing the menopause have higher odds of experiencing these symptoms, around 1.8. And then another study then also stratifies by whether it's early or later menopause. And what they found is that, again, women's odds of experiencing worse symptoms, respiratory symptoms, was higher, but particularly for those women who are experiencing early menopause. And one of the earliest studies is conducted by Zai et al. In 2022. And what they clarified in this new study was how women are more susceptible to the effects of smoking. And so what they showed in this study is that there's a strong association with women who smoke, women who experience early menopause, and worse odds of having wheeze, chronic bronchitis, and also radiologic emphysema. So the next sort of question I want to ask in talking about this is, how is asthma and COPD treated in women today, and what is recommended? Because this is something I'm personally interested in as a clinician as well. I'm sure you are. So from looking at the guidelines, what we know is that there is some guidance on perimenstrual asthma. This is something that can be tracked. There's cyclical worsening of symptoms. There's 20% decline in peak flow and reduced responsiveness to rescue medication. And there is also some international guidance on pregnancy because these patterns have been consistently seen. However, we don't have any guidance for perimenopause as well as the menopause, and in some cases isn't mentioned at all. So what this really indicates is that we really need more evidence to try and understand what exactly is happening. I just want to bring your attention in terms of guidance to a systematic review by Paolo Rogliani in Italy. And what they showed here is that men on ICS show significant reduction in severe exacerbations, and women show lesser benefit on comparable doses. So what they're saying here is that switching women to triple therapy quicker than men, even though they're presenting with the same symptoms, is better for women. So this study looked at a lot of studies in asthma and COPD, and obviously a lot of the studies were older because some of these guidelines have already changed based on this evidence here. So this is how some of the evidence is shaping guidance on how treatment should be managed, but we really don't have much more evidence than this. So moving on to the risk. In terms of the evidence, what we see is that when we talk about risk of developing asthma, that's mostly spoken about in terms of menopause and not usually at the earlier life stages. And so I'm going to present this evidence here. So how is the risk of developing asthma and COPD when we consider hormones? So when we look at asthma first, early menopause seems to be something that comes up a lot in cohort studies. As you can see from this table, early menopause before the age of 45 has been associated with about 52% higher risk of developing adult onset asthma. And if you have surgical menopause, that carries about 33% higher risk as well. And also, when it comes to hormone replacement therapy, this is where the evidence really needs to be stronger and robust. But what we can see in some of the studies is that contradictingly, taking hormone replacement therapy gives about 50% risk of developing asthma. So hormone loss and how we replace it matters. And this is something that we're trying to untangle in terms of the research that we're looking at the moment. Another thing to mention from the immunological side is that when we look at asthma that is adult onset, it's often difficult to treat. And as we know, this is because most of the treatments of asthma are geared towards treating type 2 inflammation, whereas this tends to be non-type 2 inflammation driven. When we look at COPD, what we see is that again, early menopause seems to be a huge risk factor, but in combination with one of the biggest risk factors that we know for causing COPD, smoking. So early menopause and smoking causes an even greater risk factor for women. So if women lose estrogen early, smoke the same amount of as men, and have the same pack year history, women are more at risk of developing COPD. So now I just want to sort of talk about the summary of how hormones have been shown to affect asthma and COPD. And I'm just going to give one slide on this. And this is really just to highlight that even at the molecular level, there are differences that are seen between men and women in some of these studies. And these studies have shown that estrogen and progesterone influences type 2 and non-type 2 inflammation, and testosterone appears to dampen inflammation and inflammatory pathways. So this is when estrogen is directly applied to immune cells that we know are involved in asthma and COPD, such as eosinophils. So this again is another case for the fact that estrogen has direct effects onto immune cells that are involved in the pathophysiology of the lung. But not much evidence is there on this in terms of human studies. In fact, most of this evidence comes from animal models, mice, and there's very limited data in humans. And so this is one of the gaps that my PhD is trying to address, looking at hormones, looking at sex differences and non-type 2 phenotypes in participants. And we're still recruiting, so we look forward to seeing what the results are going to give us. So what is the future, and what are the future directions for researchers and clinicians? Well, the way I see it, evidence-based medicine is based on 3 pillars, and that involves teamwork. We need best evidence, which is some of what I've presented. That is built on population averages. Often the studies that we've seen have underrepresented women, and this is a huge problem in research. And we also rarely stratify by hormones and menstrual cycle. That's something that isn't widely seen. And are we measuring the right things in women? That's a question that's also coming up. Do we have the right tools to measure inflammation, COPD, and asthma in women? Evidence also to change guidelines will involve clinical expertise and policymakers, and also involving patient context. And something that I haven't seen in the literature and would love to see more of is also the patient voice and qualitative research to try and add to this evidence to understand exactly the impact that our decisions as clinicians is making on patients. So we need research, clinical care, and patient engagement. And just to summarize the take-home messages from my talk, perimenstrual asthma is common, so ask about it. Step-up treatment earlier is needed for women, especially if their asthma is uncontrolled. This is something that is in most guidelines at the moment. And pregnancy is a key time to monitor our patients closely. And also early menopause is really something that we need to investigate further as well, because this is the evidence is building up on early menopause. And also just from a point of view of letting our patients know what the risk factors are, this is something that we can immediately go out there and educate our patients about. As a nurse, do a lot of education with patients, and so that's something that we can immediately do. So sort of summarizing everything, empower our patients, and also try and take histories that are going to help us better inform the research for the future. As a nurse, I spend a lot of time listening to patients whose symptoms don't always fit our objective measures, and this was part of this PhD project that I'm doing. But also as a researcher, I see growing evidence that hormones and life stages matter. So if you want to understand how women are disadvantaged, I think we have to look at how gender and sex interact. So thank you very much for your time. I've got some links here that I'm going to share with the team, and they will share them with you as well. So thank you again, and I'm welcome to take questions.
Well, thanks so much, Christine. That was a fantastic presentation. I think it's given us an exceptional and a really comprehensive overview of how sex and hormones affects both asthma and COPD in women. And I guess it's highlighted the need for more research, more evidence, and really agree with you that listening to the patients and using their knowledge about themselves and how their condition is affected by their hormones is something that we really need to take on board. That was excellent. Thank you so much. Questions? I know there are a few questions in the chat, but if you'd like to raise your hand and we can come to you individually, and you've got your opportunity to ask Christine anything that is really burning at the moment. So thank you again. Hands up if you want to ask questions. Debbie, I can see that you've put a really important question in the chat bar regarding testosterone. Did you want to ask that question yourself?
Afternoon. Yes, certainly I can do. Yes, thanks ever so much, Chris. Really, really fascinating presentation, and also as a representative of patient organisation, frustrating as well. The question that I had was, given the potential benefit of testosterone that you've set out in the talk regarding dampening those inflammatory responses, do you think that there is the potential to see that borne out in studies which are underway or soon to get set up, looking at the case for inclusion of testosterone in HRT regimens for women? Thank you.
Yeah, thank you very much for that question. That's a very important question that we are trying to address as a research community. I think a lot of this evidence, like I mentioned with testosterone, is more on the molecular side and also been done in mice. So I think one thing that we really need to do is proceed with caution. We can't just sort of prescribe the testosterone and add it to the regimen, because the evidence about hormone replacement therapy as well has thrown a few curveballs for us through contradictions that we don't quite understand. And I think it's because hormone replacement therapy has different doses, has different routes of administration. And so all of those things would need to be investigated thoroughly so we can find the best way to deliver this combination therapy for women. But certainly I agree. I think that we need to include studies that investigate how we can make use of giving testosterone to women to hopefully improve their asthma and maybe COPD.
Great, thank you. Kerry, did you want to come in and ask your question?
Yeah, and I actually work in ILD treatments now, but I was excited to see this because I've previously worked with asthma patients, and you just see a spike of women coming in about menopause age, and you think this has got to be hormone related, and this is going back like 15, 20 years ago. And it's really nice now that you know yourself is putting something together to say, yes, there is definitely an influence of hormones on lung health for women.
Yes, I agree. And I think what would really strengthen the evidence, like I mentioned, would also be to have the patient voices as well. As the previous speaker said as well, we definitely need to have them telling us what is important for us to ask them in respiratory consultations, so we know what to focus on, because we can see what the evidence is showing us in terms of the symptoms that we can measure. What if there's something that we're missing?
Yeah, no, I agree. Anyway, thank you. Nice presentation.
Thank you.
Great. Thanks for that question, Kerry. Any more questions for Christine? I was just going to ask you, when are you hoping to finish your research? And it'd be great to get you back again to be able to present on obviously the outcomes of your hard work. But yeah, what are you thinking for your timeline? When are you hoping to complete your research?
So we're still recruiting, and
Yeah.
I'm in my final year, so it definitely won't be while I'm doing my PhD, but certainly hoping that maybe in about a year's time.
Great. We'll definitely have to bring you back and update us all on how that's gone and the findings. But great work. Thank you.
Yes, I'll be delighted, and hopefully we can also have new evidence at that time as
Yeah.
well that I can discuss, which would be really great.
Great. Lovely. So are there any more questions? This is your last chance to ask Christine. If not, we'll finish off. But again, thank you ever so much for everybody for attending today. And I hope you've found it really helpful and useful. Our next webinar we've got planned already, and that's going to take place on the 24th of March. And that'll be a celebration, and we'll be giving an overview of what we as a network have achieved and how successful collaboration, hopefully in NHS Wales, will be able to help focus and improve care going forward, and how it's supported the development specifically around a breathlessness pathway, which you might have already been involved with or have heard of, but also the wider work that the Respiratory Network is focusing on. So I hope you'll be able to join us on that. We obviously will share the links that Christina is going to share with you. And obviously we've got the links in the chat to sign up to our future webinars. And obviously the recording will be available on our Respiratory Matters team channel, as well as our website. So before we finish, thank you so much, Christina, and for Sacco from the Respiratory Network for all of your hard work behind the scenes today and in the planning of the delivery. And again, thank you to everybody who's joined us. We really value your engagement and the opportunity for us all to learn together. If you would like certificates, then please do let us know. Just drop us a line or let us know in the chat bar. And yeah, have some time back and enjoy the rest of your afternoon. And we'll look forward to seeing everybody again at our next webinar. Thank you all so much.
Thank you.